Good afternoon, everyone. Thank you for joining us. My name is Joan Batorf. I'm a professor in the School of Nursing at UBC Okanagan and director of the Institute for Healthy Living and Chronic Disease Prevention. And I'm really delighted to welcome you here to this event this afternoon. But before we begin, I want to acknowledge that today here in Kelowna at UBC Okanagan, we are on the land of the traditional unceded territory of the Syilx Okanagan Nation and their peoples. And I want to acknowledge how wonderful it is to be on this land. And I know that some of you might be joining us from both near and far. And I also want to take a moment to acknowledge the traditional owners, past and present, of those lands as well. So this is really wonderful to welcome you to what is really our last session in the month of Embrace Aging. This has been our 8th annual Embrace Aging month of events. And so we're especially thankful for you joining us today. And I know some of you have joined us for some of the previous events during the past month. I recognize your names. So thank you for coming once again. As you know, Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention here at UBC Okanagan, along with Interior Savings Credit Union and Interior Health. We together have launched this event over the years to raise awareness about positive aging. And as you've seen through the month, we organized quite a range of events. And they're all designed really for everyone, young and old, with a focus on a variety of topics related to aging and to improve the quality of life for everybody. Our goal is to inspire everyone to embrace positive aging. And we are delighted to offer this event this afternoon. So before we begin, I just want to let you know that you might be seeing a live transcript box on the bottom of your screen. And you can move that anywhere you like on your screen just by dragging that box. So if it's more convenient, please do that. Also, if you don't want to see that box, if you hover at the bottom of your screen, you'll find a live transcript button. And if you click on that, there's a place where you can turn off the transcript. We will have some time for questions and comments at the end of the session, which will go till 2:30. So I'd encourage you, as you think of any comments or questions, please put them in the chat box at any time during the session. And we'll read those out to the speakers as when we get to that point of the presentation. So before, right now, I guess before we begin, I want to introduce Donna Rubadeau, from a volunteer from the Central Okanagan Hospice Association, who is going to introduce our speakers today. Donna.
Thank you, Joan. Hello. Yes, I am Donna Rubadeau, and I am a volunteer with Central Okanagan Hospice Association. And it is my pleasure to be here with you today, along with 2 other COHA volunteers, Iona Reitsma and Patty Walker, who are both certified end-of-life doulas. Most recently, the 3 of us have been trained to help facilitate both COHA's caregiver support programs and also to assist with advanced care planning programming. For over 39 years, COHA has provided supportive care programs and services to individuals living with serious illness, as well as to their supporting family members. We do this through our community hospice visiting program, wellness programs, vigil services, and in providing various grief and bereavement supports. Our programs complement one's medical care when living with a serious illness or frailty, at end of life, or when receiving hospice care. Our trained, compassionate, and dedicated volunteers and staff offer emotional, social, practical, and spiritual supports through all our programs and services. All COHA services are offered at no cost, and our staff work to ensure that there are no barriers to access our programs. You will find us anywhere medical care is being provided, at home, in hospital, or long-term care facilities, and at Hospice House. This is in thanks to the generosity of our community. Today, we will be delving into the specifics of advanced care planning. The information shared today and the questions asked will hopefully set you on the road to confidently completing your own ACP. Slide, please. You will learn how to do advanced care planning by identifying what you need to think about, who you need to talk to, and what components might make up your plan. You'll learn about the role of a substitute decision maker and how to identify the person you want to have as yours. The information today will advise you who to discuss and share your wishes with, and how to start a conversation with those individuals. And we will identify the elements of an advanced care plan and provide you with a list of resources to help ensure your success in this endeavor. Do note that this PowerPoint and a list of resources will be sent to you by email following today's presentation, and that will enable you to focus more on what you're hearing and a little less on taking notes. Slide. Planning for our health and personal care is one component of overall life planning and is just as important as financial and estate planning. We make wills to say what we want done with our assets when we die, and if needed, to appoint guardians to look after our children. We save money for school, major purchases, and retirement. In addition, we buy insurance in case something happens to us, our car or our house. We make preparations for day-to-day life decisions regarding our living arrangements, our diet, clothing, socializing, groceries, maintaining cultural traditions, and so on. Planning for changes in our health is another consideration we should be making in terms of our personal care. An ACP will prepare the foundation for decisions that sometimes have to be made very quickly and in situations where we are not able to speak for ourselves. While making ACP legal documents is not mandatory, a plan can give you more control over who can speak for you and the decisions they can make. You will want to prepare an ACP to help you get the care that is aligned with your wishes and beliefs. Slide. Advanced care planning is a process that involves thinking about and sharing with the people you trust your wishes and preferences for personal care and healthcare. It can include choosing who can make these care decisions for you if you cannot do so. ACP helps you get the care that is right for you, that's aligned with your values, your preferences, and wishes. All adults 19 years and older who are capable of making healthcare decisions should have an ACP, but especially people who have a serious illness, think their family may have different views or beliefs from their own, or have family members who don't know, understand, or support their healthcare choices. And it's for those who have a condition such as dementia that will lead to a loss of capacity to make decisions. Now is the time to prepare an ACP while you have the capacity to think about what you want, what's important to you, and to be able to have the conversations with those you trust. Slide. There are 3 simple steps to advanced care planning. Think, talk, plan. Think about what matters to you and who you could choose to be your substitute decision maker. Talk with the people close to you, including your healthcare providers. Plan by recording your wishes and preparing any legal documents. Slide. And if you are already thinking, this is going to be a lot of work, consider this. Having an advanced care plan is another way to show your family that you love them. You're providing them with a profound gift by taking away the uncertainty around your wishes during a time that can be fraught with emotion. Your plan can help reduce the chance of a family dispute or confusion about your healthcare wishes and enables your decision maker to communicate more effectively with your healthcare team. And an ACP is a gift you give yourself. You can access a variety of tools to allow you to get to know yourself better and to understand what's important to you. And you will find peace of mind knowing that the people you trust are aware of your healthcare wishes and can help you get the care you want when you aren't well enough to speak for yourself. You may not have any health concerns now, but being ready in case a health crisis happens will ease the burden on everyone. Advanced care planning helps people prepare themselves and the people important to them for the future, and the future can be as close as tomorrow. Following a short video, we will have Iona show you how to think and talk about your ACP. Thank you.
I would guess there's a big percentage of people don't like to talk about it. And there's a big percentage of people that it happens suddenly, you never get a chance to talk about it.
Well, of course, we are from the age that things weren't talked about.
It's not part of, hey, what'd you have for supper last night?
You've got to know what to do, what you want done.
We have to talk about this. We should talk about it so that when and if this happens, you get the care that you want.
The same day I came in, they told me I had leukemia. You can't see the leukemia going away. My wife and I have talked about pretty well everything.
Well, we did talk when you were in the hospital.
Oh yeah, I guess.
And you did make the decision. We've talked since then and before that a little bit.
What did I decide?
You decided that you didn't want any CPR and that you didn't want resuscitation.
I still think that.
It's very difficult for a family member to make that decision if there's been no discussion. Most of the time we wait too late. We're often in a critical situation when we're asking those questions.
So it is new to us to talk openly about private things. I think it takes a while to get comfortable because it is a privacy thing, eh? Even with your own family. It's not so simple to say what you want or what you don't want.
We're in a situation where we're having to communicate with family members about decisions to either apply or continue or withdraw life-sustaining treatments. Frequently you hear, oh, I don't know what Mom would have wanted. Mom never told me, or Mom never talked to me about this. And so the family then in that acute moment has to struggle with helping us make decisions with what Mom would have wanted. It's so much easier had Mom communicated to her family in advance what her wishes, what her preferences, what her values were to be.
And 15 years ago, people didn't talk about dying.
They were still going to die.
Yeah, that's true.
I do a lot of interacting with families of critically ill patients because most critically ill patients can't communicate themselves or only minimally. By and large, people are very glad. Their family members are really glad to have this on the table.
The most important person to communicate to is that person who will represent you in the event that you're unwell and not able to speak. My plan or my wishes would be that I want this, or that I would not want that.
My wife and I have talked about pretty well everything. She knows what I want.
But the main decisions are that you've decided what you would like and not what somebody else would like.
That's right.
In particular.
That's right. Not a fuss for one thing, not a big jury.
And not a crisis decision.
No.
I'm certainly glad that you and I have had the discussion.
And then the kids can't say to you, what did you do that for?
Exactly. Exactly.
Well, I didn't do it on my own. The little girls said that.
Thank you and good afternoon, everyone. My name's Iona Reitsma, and I hope that you enjoyed having a good look at that video. I think it just comes home to all of us that we do need to make sure that we have had these conversations, that we're not making decisions during a crisis situation, and that the whole family are able to participate in this, and we are able to not wait until it's too late. So where we're going to start today, we're going to start with the think process. So let's start thinking. What makes life meaningful now? What brings you joy? What religious or cultural or experience beliefs are important to you? As you read the rest of these statements on the slide in front of you, maybe that raises some questions in your own mind, or maybe you've considered these things already, or do other things pop up? Sometimes I have to admit the thinking portion of ACP can seem a bit daunting, but working through these thoughts can and does give greater clarity to your plan. Also, in exploring your thoughts around death and dying, you're giving yourself time and permission to connect with the many emotions that you're feeling. We all do learn from past experiences, with our thoughts and memories guiding us, giving not only clarity to our own values, beliefs, and wishes, but helping us decide who best would honor and understand our choices. Slide, please. So think, what matters most to you? Remember, in this stage of ACP, what matters most can depend on the stage of life you're in. Activities that you enjoy now might look quite different as you age or face an illness. However, everyone should think about who would make decisions for you if you were in a critical accident or experienced a sudden health crisis. What life support options, like refusing or receiving blood transfusions or CPR, would you accept or refuse in case of an emergency? And with what considerations? Do you wish to donate your organs after death? Also, people who are older or frail or living with a serious illness should think about what's important to you to maintain your quality of life. For example, your hobbies, your religious or spiritual practices, your preferences for food, music, art, or specific routines of personal care. Also, how do you want to be involved in your healthcare and personal care decision-making processes? Ideally, would you want to be fully involved in every decision or only the major ones? What are your thoughts about the importance of having a long life compared to the importance of feeling well and being able to do what's important to you? And as we approach the end of life, we also have to think about how you would like that experience to be for yourself and those important to you. You have to consider what comfort means to you, what suffering means to you, and what abilities or comfort you would be willing to give up in order to live longer. Figuring out the things that matter most to you takes time and energy. But it's easier to do it now than when urgent healthcare decisions are needed or required. Slide, please. So in this thinking strand of ACP, we must not look only at our healthcare wishes, but also at our personal care decisions. So in this personal reflection, here are some examples of the decisions that you can consider. And we can start by giving them a rating, and then picking your most important. Looking carefully, are there any common themes in the ratings that you've given these examples? Will these personal choices affect your healthcare wishes and what you decide as acceptable treatment or not as you age or are impacted by illness? Maybe, as an example, you rated the highest wish as to die at home and to be pain-free. How do you think you can achieve this? Well, in your ACP, in your advanced, your advanced care plan, this would need to be specified, making sure that you could or would be able to be located at home and with access to all the appropriate medication. Completing this type of activity shows how your values, beliefs, and wishes are woven into the choices that you make both with your health and personal care, and therefore becoming the voice of your own ACP. Remember, over time, as your situation changes, so might your wishes and values. And we all need to make choices which are right for us, are about us, and reflect us. Next slide, please. An ACP also helps you determine who will speak for you. Imagine if you needed medical treatment but cannot make a decision and provide consent for yourself. You will need someone to express your wishes and speak for you. This person is called your substitute decision maker, your SDN. Being unable to speak for yourself is a common situation. There may be many reasons, including before or after surgery. Maybe there's a memory loss due to a progression of dementia. Maybe there's been an accident or a brain injury. And if your health declines, maybe rapidly due to a serious illness. So what's the role of this substitute decision maker? The role of your SDMs is to make personal and healthcare decisions on your behalf if you are unable to do for yourself. These can include healthcare decisions such as providing consent on medical treatments according to your wishes and instructions, and also personal care decisions such as place of care, nutrition, clothing, and hygiene. To help your substitute decision makers make the right care decisions for you, you need to share with them your personal values and beliefs and wishes, your health and your treatment preferences, your health conditions, and your medical treatment options. Next slide, please. So let's think about who could make healthcare decisions for you in a situation when you cannot. Reading the selection that you see in front of you on the slide, does someone come to mind? Let's think again. Would they be able to fulfill all that's required of them? Remember, your substitute decision maker will speak and advocate for you. They will provide consent for your medical care or your treatments according to your wishes, and their role is to make sure your wishes are known and honored. So let's think about what would make a really good substitute decision maker. Well, it's definitely somebody that knows you well, will honor your wishes and instructions as this is their legal role, even if they are different from their own, is calm in a crisis, and can communicate healthily with the healthcare providers and not be pressured into accepting treatment that they know you wouldn't want. And also that they can handle conflict or disagreement. I'm just going to let you know that we will actually talk much more about substitute decision makers later on in our presentation today. We're now going to share with you a video from Australia. It's called Love Is Not Enough and draws attention to the value of having these conversations and thinking and deciding what medical and personal care you would want. Video, please.
My name is Donna, and Roy and I are husband and wife.
My name is Anita, and John is my dad.
My name's John. I'm Quibi's husband.
So Roy gets to go on a trip of a lifetime. Where does he want to go?
I'd say Bora Bora.
So I definitely want to go Bora Bora.
What food could Anita not live without?
Probably curry.
Anything Asian?
He couldn't live without a lot of food. And what about you? What food could you not live without?
Probably fruit in general.
Probably chocolate.
Just
Anita asked me, so what's this about? So I don't know.
You can think about a moment where you pushed through a hard time together. Can you describe that?
At school, when she was being bullied, we had to see some counselling.
Just talking me through it and helping me get through it. Kind words and lots of hugs.
For me, it was probably the time that we were first trying to have our first child, I guess. We went through IVF and things like that. Becoming parents is something that we all hoped would come naturally, but it didn't to us initially, and we worked through that together.
Roy's hurt in a car accident. He needs a breathing tube for the rest of his life, and he'll never speak again. Would you consent to this?
Well, yeah, I would, yeah.
No, I wouldn't. Definitely not. I don't think I would want to burden anyone with that. So I'd rather not. Yeah.
Anita had 3 months to live. Treatment would give her an extra 2 months, but she would never see outside of a hospital. Would you consent to treatment?
Yes, this was difficult. It's 2 months, you know, it's just 1 week, 2 months, any time.
Not at all. No.
That's unexpected.
I don't want to be kept in a hospital for forever.
Donna has had a massive stroke. Does he want a feeding tube to keep him alive, even though he'll never talk again?
No.
No, I don't. It's very important to me to be happy and functional in my life. No, I wouldn't want that to happen.
Roy's in the last stages of terminal cancer and his heart stopped. Does he want CPR?
Probably not. I don't think you would. No, I don't know.
So how do you both feel after answering those questions, and why?
It felt quite confronting in a way. But
You think about it and you talk about it just very lightheartedly, but I don't think anyone really puts a lot of thought and serious thought into it.
No.
Why do you think that some couples don't talk about this?
It's not a pleasant subject. I mean, nobody wants to dwell on the fact that they're going to die one day, and possibly in adverse or difficult circumstances.
So if I was to tell you that advanced care planning is essentially a conversation that helps your loved ones know what medical treatment to choose for you if you had a sudden event, what would you think about it now?
I think it's a great idea.
Yeah, absolutely.
It's important, not just for yourself, but more so for your family, I think.
Definitely have to have a bit more talk, and it's not just about the two of us. We also have kids and all that kind of stuff. Yeah. So there is a bit we need to consider. Yeah, 100%.
I hope you found that video as powerful as the three of us did. We felt it sent the perfect message as to why we think and believe ACP is so important and for everyone. And they're not talking just about the ACP being a gift to yourself, but really as a gift to your family. I think it touched on some amazing family relationships. And did you not find it interesting that how one can think about how one can think one knows what a loved one would want, but until you've actually had that conversation, you never really can be sure. And studies have revealed that thinking and preparing for your own death actually allows you a greater freedom in order to live life to the fullest right now. Next slide, please. So this leads us perfectly into our next step in our ACP journey, which is having the talks. No doubt it's an emotional conversation to have with your family and loved ones, but it's critical to have them sooner rather than later and as often as you need. Making sure that you spend the time thinking about what should you talk to your friends and family about. So you need to share your thoughts about the things that are important to you, your values, your beliefs, and your preferences. You need to talk about your fears and concerns about your future health and illness. Talk about any specific treatments or healthcare decisions you already know that you want or you don't want, and discuss who will make those healthcare decisions for you if you cannot make the decisions for yourself, if you're incapable. And explain to your other family members that you would like them to support the person chosen to represent you when decisions are made. Next slide, please. So now you know that you need to have these conversations. They're key, but how are we going to start them? Here are some examples of conversation starters, and see if one might help you, or maybe you have your own ideas. Trust me, they do get easier the more times you have them, but it's important to have as many as you need and to be prepared. During this COVID time, this has been an ideal opportunity for families to get together and say, especially from parents saying, during COVID, we really feel that we want to get all our papers in order and we want to start having these conversations with you and your siblings about what we would like and how we would like to be cared for. Next slide, please. So how might you prepare for what matters most to you with your family and friends? Well, you do need to prepare ahead of time. Write down the topics that you want to talk about. And I have to say, in this instant, the notebook is your friend and a great tool in the whole process. Even write a script, people say, if necessary. You want to think about what matters most to you. Who do you want to talk to? Who would you want to choose to make the healthcare decisions for you? Will they fully agree to fulfill that role? Remember, you do have to ask them and they have to understand what they are undertaking. And the reasons why you want to have these conversations and what you'd like to accomplish by having it. You need to pick a time. Pick a time when you and the person you'd like to talk to feel relaxed and have time to talk. Choose a place that's free from distractions where you all feel comfortable, and be gentle and go slowly. These conversations touch on vulnerable and intimate topics which can be difficult to talk about. Being empathetic with the person you're speaking to is key, and learn to be patient. And be open to learning and hearing what each person has to say. Each person is entitled to hold their own values, beliefs, and preferences, and having these conversations lean into a kind of two-way street can make family and friends feel so much more comfortable. Not only making them feel, as I said, comfortable or at ease, but it allows them to share their feelings and their fears, and they themselves are able to be heard. And every attempt, remember, every attempt at a conversation is valuable. Be open to having the conversation in smaller chunks. It may take a few pre-conversations to even begin to talk about advanced care planning. You'll know what best fits your situation and go with your gut instinct. Also, you can use the ACP aids, such as the websites and the leaflets and the videos we're going to suggest at the end of the session today. They may help. And it may also help to talk about healthcare situations that have happened to people you know, and compare their situation to what you would want or what you would not want. But always remember to start by discussing the present. Don't go straight to end of life. Emphasize that living well includes planning well. Next slide, please. So not only do you have to talk to your families and friends, but there are other conversations that are critical. And these are ones with your healthcare providers. You need to know and understand your own health So ask. For those who have a health condition or a serious illness, talking to doctors, specialists, nurse practitioners to get information about your health and that can help you when thinking about what matters most to you. And this could include, how do you expect my illness to progress? And are there stages to plan for? How will my abilities and life be affected? Considering the impact on your spouse and on your family. What kind of healthcare treatments may be involved as my illness progresses? And what are the benefits and risks in the treatment options? Are there any alternatives that you could explore? Will life support treatments be considered for me? And at what point? Will I need to be fed through a tube, hooked to a ventilator, or any means of life support to keep me alive? And do I want that? It's important to take time to reflect on the answers that you get back from your healthcare providers, because what you learn from these discussions will help you think about what matters most and who you would want to speak for you if you cannot. But the bottom line is, remember, there is no right answer. It's just what's right for you. Also, as we're asking questions with our healthcare provider, you will also be sharing information with them. This can include, of course, what matters most to you, your values, again, your beliefs and wishes for your health and personal care. And this will help the healthcare provider to consider the care options that are best aligned with your values. Knowing what patients accept and find unacceptable in their levels of intervention and care allow for a much closer and less stressful relationship, especially when decisions have to be made quickly. And they also need to have to understand who is going to be making your healthcare decisions for you. In other words, who your SDNs are. And also possibly introducing your SDNs to your healthcare team allows for a greater connection and honoring you, your voice and your ACP. We must remember that talking to healthcare providers is an ongoing process. The questions you ask and the answers you receive may change as your health changes and illness progresses. Next slide, please. Talking to your healthcare providers. How might you prepare and start the conversation with your healthcare providers? So here are some tips that can help you have the conversations. Making sure the most important is that you've prepared ahead of time. Write down the questions and topics you want to talk about and think about reasons why it's important for you to have these conversations. What do you want to accomplish by having them? Which healthcare providers do you want to talk to? Making an appointment and allowing them to know what you're coming to talk to them about, because often they will turn around and say, you know what, Iona, we need to make several appointments in order for this to be achieved. Select a time also when you're feeling most capable of understanding the information that you're going to give and receive, i.e. you're not stressed or exhausted. And inform them of the topics of discussion and the amount of time you need. Invite also someone that you trust to participate in these conversations. Ideally, maybe you're a substitute decision maker so that they can learn your preferences for healthcare, but they can just give you the moral support and help with note-taking and recording the conversation for you. Other strategies, ask for a quiet room free from distractions and work with a language interpreter if that's needed. So as I draw to a close for this, these two elements of our ACP, we must remember that talking with family, friends, and the healthcare providers is an ongoing process. The questions you ask, the answers you receive may change as your healthcare changes or your illness progresses. There's no right answer, just what's right for you, your voice, and your ACP. Thank you for sharing that time with me this afternoon. And I would like to ask Patty, who will now move us on to the plan stage of ACP. Thank you.
Thanks, Iona. So once you've had a chance to think and talk about your wishes, Now is the time that you should be recording this information in your advanced care plan. You've heard Iona refer to your substitute decision maker as the person who will speak for you. And there's actually a few different ways that that can happen, which I'll be going to in more detail. But for the time being, I wanted to share with you sort of an overview of what you might include or might have included in your advanced care plan. And then we'll walk through some of them in more depth. So first of all, an advanced care plan would be a record of your values, beliefs, and wishes about future health and personal care, what matters most to you. That can be written down, or it could also be recorded in an audio or video recording, something that whatever you feel most comfortable with and that would work with the people that you're wanting to share it with. It would also include contact information for what's called as your temporary substitute decision makers, which I'll speak to in a sec. Those are the basic components that you should have in there. There's also some optional information, legal documents that you might wish to make. And so those would include either a representation agreement, which is used to appoint one or more people who are known as your representatives to act as your substitute decision maker. And also you could prepare and include an advance directive, which is another legal document which is used to record instructions to your healthcare providers about treatments and care options that you consent to or that you don't want to have. Preparing an advanced care plan, or ACP, can help you clarify in your own mind what your beliefs, values, and wishes are around healthcare. So that process helps you really zero in yourself. And it also helps those people who are involved in your care, especially your substitute decision maker, because it helps kind of remind them of what your wishes are. It helps to guide decision making. And it also provides evidence of your wishes in case there's a disagreement. No one can say, well, mom told me this or mom told me that. If something is clearly laid out in a plan, that it eliminates that issue. Of course, as long as you can still make your own decisions, your ACP won't be used. The documents only come into play when you become incapable of making decisions about your care. So as I mentioned, we refer to an SDM as an individual, but it can also take the form of a written document as well. So each legal jurisdiction, each province uses slightly different terminology and documents, but the process is essentially the same from province to province. But for the purposes of our discussion, we're going to be using the terminology and the documents referred to in British Columbia. So as you see here, there's actually three options or three different ways that you can have decisions made on your behalf in the event you're not capable to decide for yourself. The first one, the temporary SDM, is actually already available to you and doesn't require any action on your part necessarily to have that available. The second two do require preparing some legal documents. So first one then, option being a temporary substitute decision maker. This option would be if you need health care and you aren't capable to make the decision, and you don't have someone or you don't have a representation agreement or an advance directive in place that speaks to the situation. Then your healthcare provider will refer to a list that's established by the province of who should be consulted on your care and in what order. The person that they select from that list is called your temporary substitute decision maker. The authority of the TSDM only actually applies to specific healthcare decisions at a time, or the one that's at hand at that moment. If there's another decision that's required later on and you're still not capable of making a decision, your healthcare provider will use the list again to identify a TSDM. So to qualify to be a temporary substitute decision maker, the person, first of all, has to be 19 years of age or older. That's the age in BC. They also have to be capable, have no dispute with you, have been in contact with you in the last 12 months, and also, of course, be willing to comply with their duties as a TSDM. And your healthcare provider will work down the list that's been laid out in law in the order that you see here. So it starts with your spouse would be the first person they would consult with, then a child, then a parent, then a brother or sister, and all the way down on that list. If no one can be reached or qualifies that are on that list, someone authorized by the public guardian and trustee will be chosen, and that's usually an employee of that office. If there is more than one person in a role, then each one is ranked equally. For example, if you have more than one child or more than one sibling, it doesn't go in order of birth or anything like that. They're all ranked equally. So the healthcare provider will typically pick whoever they can reach first. So as part of your advanced care plan documents, it's really a good idea to make a list of the names and the contact name or the contact information of the people who would potentially be qualified to be your TSDM in that order. And as Iona said, we have a number of resources that we'll be sharing with you at the end, and also be sending some information out. But this document is one that can be quite useful for you. It's My Voice Advanced Care Planning Guide by the province of BC. And a number of the forms that I'm going to be referring to, including the list of temporary substitute decision makers, is in that book. So you can use that as a guideline. You don't have to kind of reinvent the wheel. There's information already there. The other thing that's important with the TSDM is that if there is someone on this list that you don't want consulted, for example, they don't have the same values as you, or there's been a dispute of some sort, and you don't want the doctor to come to them at all, you can actually identify them as ineligible on your contact list. So you still include them, but you make sure that you just note on it that that individual is not someone who's eligible to be consulted. So some of the limitations, there are limitations to the decisions that your temporary SDM can make. For starters, they can only make healthcare decisions for you. They aren't able to make personal care decisions. So similar ones that Iona showed you in that example. Specifically, personal care decisions that we're talking about are things related to your daily life, such as your living arrangements, including admission to a long-term or a care facility, diet and dress, and other day-to-day decisions like those. Participation in educational, vocational, or social activities, who you have contact with, access to personal information, and any restraint issues. And also, as I said, the TSDM is only appointed for one decision or set of decisions at a time. So because of that, the person who's selected by the healthcare practitioner at that time, the person who's selected as your TSDM might not be the same each time. So depending on the eligibility and availability of the people on the list, you might that person might change for different decisions. So a factor you want to consider. So a second option to a substitute decision maker is someone that you've identified in advance through a representation agreement. And that's a form that's signed by you and your representative, and it's verified by a witness. So it is a legal document in which you name a capable adult, who's your representative, to make personal care and healthcare decisions if you're not able to make those decisions on your own. Appointing a representative is actually the best, gives you the best chance of the person making your decisions for you being the same person over time. And many of the limitations of a TSDM don't apply for a representative. You can name more than one person to act as your representative, and you can also specify what decisions they can make and how they can act. For example, you could appoint one person to make your personal care decisions and someone else to make healthcare decisions, all in the same agreement. If you do appoint two representatives, though, in two or more in an agreement, unless they have different areas of responsibility or authority, they have to act together or unanimously, unless your representation agreement says differently. And this is an area that many people stumble over a bit because, for example, if you have two children, adult children, and you want them to share the role of representative, our tendency is kind of to make them joint, appoint them all as joint representatives. But if you do that, as I mentioned, if one of them isn't able to act, the remaining representatives can't actually continue to act unless your representative agreement says otherwise. So it essentially nullifies their role as a rep unless you allowed for that situation. And that might not be, may or may not be what you'd like to see. If you do want one representative to be able to continue on, your rep agreement needs to address that. A better alternative would be to appoint one as the main representative and one as an alternate. And if you do have an alternate representative, you have to specify in your rep agreement when they can act in place of the representative. So it's really clear who's in charge or whose responsibility is at any given point. And it is a legally binding document, but you don't actually need a lawyer or a notary to prepare one. There are some restrictions, though, on who can witness it. For example, the witness can't be a spouse or a parent or a child of a representative that you've named in your agreement. There's actually two different kinds of representation agreements. One is called in BC a Section 9 or Enhanced Rep agreement, and the second is called a Section 7 or a Standard Agreement. I won't read you the differences you can see on this screen, but really the key highlights of the differences between them are the requirement for capacity of one of them versus the other, the scope of health-related decisions that are allowed, particularly regarding life support treatments, and ability to make routine financial decisions. If you need help with personal care decisions, appointing a rep is actually the only way that someone you choose can legally make these decisions for you. If you do employ more than one person, it's really important that you talk to them beforehand. First of all, to make sure that they agree to that joint representation and that they know your wishes, values, and preferences for your health and personal care. Although I said you don't necessarily need a lawyer or a notary, it is recommended in some situations that you do involve one, particularly with people who have a diagnosis of dementia. And the reason you might want, especially if your circumstances are such that there might be any concerns about capacity, such as with the progression of dementia. If you anticipate family disputes or confusion over healthcare decision-making, or if your requirements don't really fit in with the standard templates. For example, you'd like to appoint multiple representatives with different parties or different set of decisions, an alternate and that sort of thing. So in those situations, it might be advisable or it's recommended that you do consult with one of those professionals. So the third option for a substitute decision maker is to use an advance directive. So in this case, rather than a person, your substitute decision maker is actually a legal document, and it records your instructions for accepting or refusing specific healthcare treatments. You have to be capable to make an advance directive, and it only covers healthcare decisions, not personal care, not financial or legal decisions. The document has to be clear about the specific treatment that you would want or you refuse to accept. It has to be in writing, and it has to be signed, witnessed, and dated. Some of the situations where you might want to make an advance directive is if you maybe don't have anyone to appoint as an SDM alternatively or to make healthcare decisions for you. Sometimes, you know, we're left, we have no adult children or no siblings or no one close to you. So an advance directive is a way that you can make your decisions known without having to have that person to rely upon. And it also can be useful to have an advance directive if you have certain instructions that you want to be legally binding, or you want to spare your substitute decision maker from making certain decisions. So there might be some things that you feel would be really difficult for them to decide on your behalf. You can avoid that problem by having some clear direction in your advance directive. And it's also really important that you talk with your healthcare provider before you make an advance directive. And that's to make sure that, first of all, you understand the treatment options. Different diseases have expectation of certain things happening as your illness progresses that you might want to be aware of treatment options for. You want to make sure that your directive is clear and specific as well, and that you understand how what you write would be interpreted. So your healthcare provider can really help to make sure that there's clarity around that. So there's no dispute or confusion if that advance directive is ever called into play. It is hard to cover every possible decision in an advance directive. So it's still important to have a representative to be your voice if you can have one, a representative to be your voice when you aren't able to speak for yourself. Your rep should use your advance directive to guide them in making decisions on your behalf because of the intent there, but they still will be asked about all directions unless you state in your rep agreement that they shouldn't be asked about decisions covered by your advance directive. So if there's anything that you think that they might have trouble following through with your advance directive, then you can make note in your agreement that that decision is not one that they're to make. So just to clarify, I've kind of thrown a bunch of terms for you, and we just have this chart to help assist with understanding the hierarchy of that decision making in healthcare. So if you're capable, of course, you're always the first and final person who is making healthcare decisions. The rep agreement and the advance directive, as you can see on this chart, those two supersede or can override the temporary substitute decision maker. And again, if you have both a rep agreement and an advance directive, the representative has power to veto directions that are included in your advance directive unless you specify that that's not the case. So to summarize what I mentioned here in terms of what you should include in your plan, it should be a written record or audio or video recording of what matters to you, your values, beliefs, and wishes for healthcare and personal care. The contact list of temporary substitute decision makers, eligible ones, who with notes about who might not be eligible, and any legal documents you choose to make, such as a rep agreement and advance directive. And as I mentioned, the forms for all of those are available in My Voice and also through other tools that you might use instead. And again, as Iona has stressed, conversations are key through this whole process. So once you have a plan, make sure you share it. It doesn't do you much good if no one knows about what that plan is. So the first part of that is keeping all documents together in a safe place where it can easily be found if needed. So that means don't keep it in your safety deposit box. A number of people say, well, you know, I have my will and all my important papers in the safety deposit box. If you're in an emergency situation and in a coma, no one is going to know how to access your documents in a safety deposit box. So make sure that it's accessible and make sure you tell your family where that document is. First responders also know to check on or near a fridge for your healthcare planning documents. So that's a good place that you could store them as well. Of course, you should share copies with your substitute decision maker, your close family and healthcare providers, and also bring the documents with you if you go to the hospital. And one of the ways, if you and your partner both have them, one tool that I've found to be handy is to have a different color envelope, or like you can get clear plastic envelopes at the dollar store or someplace, and they come in different colors. So put yours in one color and your spouse's in another color, and that way you don't accidentally in a hurry grab the wrong one to take with you. And also there's another vehicle open to you that many first responders or other people know to check your phone in your contacts list under it's ICE, and it stands for in case of emergency. And if you have that on your contact list in your phone, and then list who the people should be contacted, either your substitute decision maker or other family members, that's another place that you can keep information and share information about your plan. And finally, it's not a one and done kind of thing to prepare your advanced care plan. It's important that you review it on a regular basis. Number of reasons why: our health, our illness, and treatment choices change over time. And as our health changes, so do our decisions about what we consider to be tolerable and intolerable. What might seem like an intolerable quality of life today when we look down the road might look more tolerable when we're actually in that circumstance. It's recommended that you review your advanced care plan and all legal documents at least once a year. You could do it the day after your birthday. Probably most people don't want to do it on their birthday, but you can choose to have that as a reminder or anytime, but ideally have it reviewed, kind of once a year. And there's other circumstances that you should also review your ACP when you have a change in your health. For example, you have a new diagnosis of a serious illness, you have a decline in health, those type of things. Your life your life circumstances change. For example, if you move, maybe the person that you had appointed initially was your neighbor or your best friend down the street, much easier for them to be reached. But if you move across to a different province, that person might not be as good of a choice. So you might want to refer that then. Also, if your relationship to your substitute decision maker changes, you could get married, divorced, widowed, any of those things. So those are all circumstances that you want to consider reviewing and making changes. And the process you use the same as what both Donna and Iona has laid out, the think, talk, and plan. You think again about what matters most to you and who could make decisions for you if you can't. You talk to the people you trust, your representative and your alternate representative, and your healthcare providers about your new plan. If you don't have a new plan, if nothing's changed, then it's still good to just remind them of what your values and wishes are and where your up-to-date ACP documents are located. If you do want to make changes to your advanced care plan, records and documents, it's probably better to do new documents as opposed sometimes we just stroke out things and initial them or whatever, but that might make it a little bit more confusing down the road. So it's ideally if you do make changes, you do a new document, and you can also refer in that document that it replaces or overrides, that sort of terminology, to the previous documents you have. And of course, if you update any documents in your plan, make sure that you give copies to anyone who had copies before, whether they're your doctor or your family or whatever. And it's a good idea to ask them to destroy copies, or you can ask them for them back, and that way you can make sure that they're destroyed. So it always seems like something that we put off because we think we don't need to do it now, it's too soon. But as this quote reflects, it's always too soon until it's too late. So don't hesitate today to do it because it feels like something that's really out there. It's important to start it as soon as you can. And as Donna mentioned, anyone who's an adult is eligible, and it's preferable for them to do an advanced care plan. It's a big undertaking, though. It feels like a big undertaking, especially when you're first starting out. So some of the things that we thought of that are ideas that could help you kind of walk through that process is, first of all, talk to other people you know who've done advanced care plans. Maybe your friend has done one and they can give you tips about what worked for them or things that they found difficult and help you through that. There's also a number of, we call them conversation starter games that are coming out. People are becoming more and more, particularly with COVID, becoming more aware of our health and death, and sometimes having a game or a starter conversation, things such as a number that you can find online. You get together with your family and you say, hey, let's spend an hour or so and go through these questions. And it starts to normalize the conversation that we have around death and dying and around our health. And so that might be a tool that you can use that would help that conversation starter, as Iona was referring to. Give yourself time to reflect on your beliefs, values, and wishes. It's not, you don't want to go right to the documents. It's really important that you take time to think about what you want and how you would like to see your healthcare decisions made. And part of the reason that we want to make sure that you document that in addition to the plan is because it's really hard to identify in advance every situation that we might come up against that we want to make sure decisions are made for. And if you include your beliefs and values and wishes as part of that document, then your substitute decision maker or others have something else in addition to the specific directions you have to give them a sense of what matters to you. So if they have other decisions that they need to make, they have some guidance that will support them in that. You can also use a buddy system, like getting an exercise buddy to keep us on track and get and stay motivated. So maybe someone else that said, man, I really want to be doing that, but I haven't done it yet. Buddy up with them, and then you can kind of coach each other and help stay through that process. And also, both Iona and Donna, I think, alluded to the sense of it being potentially a big process. Like break it up into bite-sized pieces. You don't have to answer everything in the first day or the first 2 hours that you're working on it. Do a little, reflect a little, do a little more, reflect a little more, like give yourself a little bit of time. It's a very important process that you're going through, and it's not something that you want to rush. And definitely celebrate your progress. The work that you're doing on your plan, or the work that you undertake on this, is really important work. And it's such, as I always said, it's such a gift to you and your family and everyone, that every step along the way deserves celebration. And it helps us to stay motivated, not just waiting till the very end when we're all finished that process. And again, we have many tools. There are many online tools or otherwise that would support you. I mentioned the My Voice. A number of people find the Dying with Dignity Canada document to be a little plainer language and a little easier to follow, but they also have similar forms. And as we mentioned, along with the slides, the copy of the presentation, we'll be sending you out a little bit more detailed resource list that includes these as well as some other things. Excuse me. And some video links that you might find useful, or maybe you want to share them with other people to have an understanding of what it is that you are undertaking and why. So that is the essence of our formal presentation. And again, we'd like to kind of open it up. I'll stop sharing the presentation, and then we can have a chance to answer some of the questions you might have. All right.
Yeah, wonderful. Thank you very, very much. So for those of you in our audience, I would encourage you to type in your comments or questions. We'd be happy to address those now. And maybe I'll just start it off while people are thinking and typing. I learned a lot from the presentation, so thank you very, very much. Based on that long list, well, relatively long list of resources, if you were just sort of starting off for the first time, is there one that that you would recommend? Because I'm expecting you wouldn't need all of them at
For
once.
sure not, yeah.
No.
Yeah, like, and really, like this document, the My Voice document, is a wonderful resource, and it's available online. So you can download it. You don't have to buy the book. And it gives a lot of information as well to support what each of the roles are. And it has the forms in it. So it's probably the one that, I mean, that's the one I use as my kind of motherhood document for referring to this stuff. And that's my sense. Iona and Donna, anything you want to add or change on that?
I agree that My Voice is a great way to get started, but we all found in researching various resources that would work for our presentation that you can go down the rabbit hole if you get on Google.
I bet.
Yeah, I totally concur with what the girls are saying. I went ahead and got this book, and it's on our list, Advanced Care Planning. I just like the way it's laid out. It would certainly go really well with the My Voice. And also, I know, Donna, you like the Dying with Dignity, resource as well, didn't you, personally?
Mm-hmm. Yes, I found it a little bit, My Voice is great for all the information. It's also with the Dying with Dignity on their website, and the documents that you can print off. But there's just, what we showed today, I think, gives a pretty clear picture of the components for your plan. And you'll find a document that works for you, I think, with some of the suggestions that we've made on our resources list.
So if one's not really working for you, try another one, is what you're saying. Yeah, because it looks like lots of good resources out there.
To avoid being overwhelmed, focus on one or two and then decide between the two what works best.
Yeah, and I understand there's different regulations, I'll call them, for different provinces.
Yes.
Are some of those resources, they're all appropriate for BC residents?
The ones that we've mentioned on our resources list are all for BC.
Okay.
But there are some that we have in there that are Canadian wide. I believe that I think we have the Canadian in there as well. There's special documents for that, and the conversation project, that's not BC specific. Like there's a number of them as well that are applicable beyond BC.
Yeah, so just something to keep in mind when we're reviewing those sources.
And it's the most confusing thing too is around the terminology. You know, like it's a representative in BC, but you know, and I can't off the top of my head remember, but I know Alberta's is different. Like it's more, you know, and we use other terms like living wills, and you know, those can be confusing. But that's the terminology that we specifically use here.
Wouldn't it be nice if we all used the same language?
Yeah, no kidding.
Oh, goodness. So Judah has a comment. My doctor has done MOST, most with me. Where does this fit in your presentation? Maybe tell me what a MOST is.
A MOST stands for, MOST stands for Medical Orders for Scope of Treatment. It is a physician's order, also referred to as a medical order, that outlines a plan of care respecting the patient's wishes concerning care at life's end. So she has done, Yuta has said that she's done this with her doctor. So that's part of the conversation that she's had with her doctor as to her preferences, and then she can incorporate that into her plan.
Okay.
And the same, so there's that document, and there's also the no CPR document. So if you feel either of those are relevant for you, then I would include them then same as Donna said with your other advanced care plan documents, they should be included there as well.
Okay. Okay, that's very helpful. I thought that was a great idea about putting in case of emergency on your phone. I had not thought about that. That is a great suggestion. I'll have to do that.
Can't claim the originality of it though, but I'm glad it was useful.
That's a great suggestion. Is there, and I know that there's probably not a right answer to this, but I guess, you know, is there an age where people should be starting to think about this or doing it, you know, getting an advanced care plan? I know that, you know, many younger people don't really think about this sort of thing. And so I guess I'm wondering, is there an age that you get to where you should be thinking about this if you haven't already?
I think Iona has a great example for that one.
Oh, good.
Yes, I do actually. So my son was in a head-on collision before Christmas at the tender age of 22. And so that really prompted me over Christmas to think about and get discussing with all my children about having an ACP. Fortunately, he walked away from the incident, but it really brought to light. Not less than a week later, we did our first ACP workshop for our COHA volunteers as part of a COHA initiative. And so it really brought it home to me that in fact, it's not just for your end of life care, it's for your life care. And what would my husband and I have done to honor if he hadn't been able to speak for himself? Mm-hmm. What decisions would we have made, hand on heart, you know, in order for him to have the level of care and how he would want to be treated also. So I just kind of think it really, as Patty mentioned, over 19, you're eligible to make. If you're capable, you're over 19, you are able to make an ACP.
Okay.
So it's not just for us towards the end of, you know.
That's a great example of why it's important for anyone over 19. We have a comment from Jennifer. Before this great presentation, what I assumed that my will establishes who would make these questions. Now I understand more comprehensive set of decisions that may be addressed. So do we remove this power of attorney?
Sure, I'll take that one. That's a really good question. It's one of those terms that we also get quite confused. And the power of attorney and an enduring power of attorney are responsible for legal, or they have authority to make legal and financial decisions. So your representative is your healthcare representative, really talking about the Rep 7 can make some financial decisions, but it's really the power of attorney and the enduring power of attorney that you need to have that ongoing responsibility and support to those. And the difference kind of between the power of attorney and enduring power of attorney is that the enduring power of attorney retains that role even when you become not capable of doing those things. So you can have a power of attorney that works on your behalf while you're still capable, but the enduring power of attorney carries on from that. So the representative agreement is the only one who can make your health and personal care decisions, but the power of attorney also can do those other things, which you still probably want to have appointed.
So, and then the power of attorney would be in your will. Is that right? Typically, I think that's where hers is.
Mine is a separate document.
Okay.
It's not, your executor is in your will, and you have a
Right.
second document that talks about who your power of attorney or enduring
Okay.
power of attorney is.
Okay.
But I'm not a lawyer, so I make sure that clarify that.
So don't remove the power of attorney that you might have already established unless you really want to change it.
Yeah, if it's not relevant for you. If you thought your power of attorney was going to be making health decisions, then you need to rethink that. But
okay, that's good advice. Yeah, Joanne just saying, wonderful presentation, very informative, and I couldn't agree more. It's been really, really helpful. And Jaquette has just encouraged people to type in any questions, and Jennifer is saying thank you. And Barb, doctor secretaries are asking for written proof of representation before giving out information. Do you have any comments about that?
I don't know what that would be. I've not heard that.
So
unless they're talking an advance directive, perhaps, but I've not come across them asking for that kind of thing. But if maybe they're asking if you have a representative, then you have the representative agreement, then that's what you would bring, I think is
yeah,
what.
I think maybe they're asking for proof of that by actually bringing the piece of paper.
Yeah.
Mm-hmm. Yeah, and I see that Joanne has written, is that due to privacy? And I would imagine that would be, because just as you look at the list of temporary substitute decision makers, the information that the conversation with your healthcare providers is very limited to who could have that conversation.
Right, right.
I did see something kind of pop up earlier, and when I went and looked in chat, I didn't find it again, but I thought someone had asked about MAID requests and how that fits in there. And I don't know if I misread that, but just want to clarify that a MAID request is a separate request that needs to be made. And currently our legislation doesn't, there's no provision for advance requests for MAID. So putting that in your advance directive would not be what you would need to do to request that. But just, I don't know who was that asked.
Yeah, that's a good point of clarification, actually, because there's been a lot of talk about MAID in the news lately with the change in legislation. So that's very helpful to know that you don't do that in advance, but should the time come, it's a separate conversation and issue.
Yeah.
Yes, and Barb says, yes, the stumbling block was privacy. So I guess having those pieces of paper in a safe place, an accessible place, and a place people know where to find them is a good idea. I know my parents had a green folder and it was on the top of the fridge. So
yeah, quite often they refer to green sheets as, you know, what they, and some, I think Alberta's, they actually have the green folders, but anything that kind of fits that doesn't necessarily have to be green.
Okay. Yes. Deborah, thank you to all the panelists for their work in presenting in a very understandable way. And I have to agree with that as well. It's been very understandable. So as we maybe move to close this session, I'm wondering if I can ask you each to maybe give some last words of advice for us and for our attendees. Patty, do we want to start with you?
Sure. I guess to me, the biggest thing is don't be afraid to start. You know, every little bit that you do helps, and it makes it easier to do the next step. So, you know, even if you just start thinking about your wishes, everything becomes easier once you start that process. Just start it.
Great advice. Thank you. Donna.
I'm going to quote Deborah in the chat. It says, "Eat your elephant one bite at a time."
Yeah, absolutely.
Going with that.
That's great. Thank you for that. Iona.
Well, they nicked that was my comment, because my sister-in-law always tells me that. I would encourage people to say that, you know, don't wait until it's too late. I think we need to go with our last comment, is that, you know, it's always too soon until it's too late. I really think that is the crux of our discussion today. So make a plan and let's start talking.
That sounds great. Thank you so much. And we will be sharing those resources for everyone who's joined us today. So watch for your email. And of course, we're recording this session today too, so it'll be available for people to have a look at again if they want to go back and listen to anything as well. That's also possible. So in closing, I do want to thank our presenters. This has just really been fabulous. And as you've seen, some of the comments come in, other people agree. We've learned a lot, and you've explained it very, very carefully and well. So thank you for joining us all today. And thank you to our attendees today too. This is our very last Embrace Aging for the month of March. And we've had a very successful month of events and lots of participation. So we're delighted to end it with such a positive and informative session. And I encourage everyone to stay in touch with the Institute for Healthy Living and Chronic Disease Prevention. Occasionally, we host some other Embrace Aging events throughout the year. Most of them are in March, so stay tuned for next March, but watch for some other events that we'll be hosting over the time till March 22. So with that, I will close and hope you all have a great Easter weekend. So thank you again, everybody. Bye for now.
Thanks very much.
Thanks for having us.
Bye-bye.
Bye.